Welcome everyone. The topic is miraculous treatment response with cyclophosphamide in 3 VGKC positive cases. Myself, Dr. Govind Madhav, consultant neurologist at CNS Ranchi, along with my co-researcher Dr. Suparna from CIP Ranchi. The aims of the and objectives are to establish efficacy and safety of cyclophosphamide as a cost-effective alternative treatment of rituximab in VGKC positive cases. 3 VGKC positive cases were selected, 2 with Morgan syndrome and 1 with limbic encephalitis. The biochemistry, MRI, EEG, and CT thorax and abdomen were done to rule out the mimics as well as underlying malignancies as well as underlying chronic infection, just so that we can start the immunotherapy. After ruling out this condition and making the and ascertaining the diagnosis, we have started IV methylprednisolone 1 gram daily for 5 days, followed by we have taken consent and started on monthly pulse of cyclophosphamide as a 500 milligram per month, along with the MACE9 and other measures as per the protocol for 6 months. So here are the results. The first case was a 40-year-old male who presented to us with 4-month history of chronic insomnia, muscle cramps and depressive symptoms. Neuromyotonia were visible clinically as well as the EMG. He was positive for both Casper as well as LGI1. So along with the immunotherapy, he was given carbamazepine, pregabalin, amitriptyline as well as clonazepam for the to reduce these symptoms as the supportive measures. His symptoms resolved completely at the end of 3rd month with medication, and he was off carbamazepine, pregabalin and other supportive measures by the end of 4th month. He has completed the 6th month of the therapy. He is still in follow-up and he is not having any of the symptoms. The second case is a 45-year-old male who presented with 6-month history of insomnia, muscle cramp, as well as significant weight loss of more than 10 kg over the last 6 months, unexplained, along with severe anxiety symptoms. He was also having neuromyotonia. He was positive only for the Casper. He was given gabapentin, propranolol for the anxiety symptoms, and lorazepam as well as carbamazepine. His symptoms resolved at the end of 4th month, and he was off all these medications by the end of 5th month. The third case presented with classical symptoms of rapidly progressive dementia that is typical of limbic encephalitis. He was positive for LGI1. MRI was showing classical finding. He was on more than 4 anti-epileptic medications, but by the end of 6 months, he was only on levetiracetam and he was symptom free. So we can conclude that although literature had documented significant side effects of cyclophosphamide, but none was observed in our case by the end of 6 months, and the treatment response was comparable, just like any other immunotherapy. So much larger studies are required in future so that we can establish the efficacy as well as safety of cyclophosphamide, so that this can be a cheaper alternative for the underprivileged class of the society. Thank you.